Is the vaccine of benefit to me? It actually is really good at preventing disease from COVID, preventing hospitalization and death. The more people who get vaccinated, the better. We now have over hundreds of millions of these vaccines being given around the world. We are way past any experimental stage. I also want to say that even in the beginning, when indeed it was more experimental, when clinical trials were going on, these clinical trials had 20 to 40,000 people included in them, which is a huge number for vaccine trials. So all these studies and now the number of people that have had the vaccines, surveillance happening with these vaccines, these are no longer experimental. So it's actually been shown to do all of those things: prevent against asymptomatic infection, against disease, against severe disease, and now we're showing that it prevents transmission as well. 2 doses of a vaccine in Israel have also been shown to be 90% protective at preventing asymptomatic infection. So these are people who may have COVID, carry it, and not have infection. And then now we're seeing that there is indeed a prevention of transmission. So even after 1 dose of a vaccine, there is about 60 to 70% protection against getting the disease, against getting COVID. And then on top of that, 50% less likely to prevent transmission. So if you've had the vaccine, you're 50% less likely to transmit. This news on AstraZeneca does seem to keep on changing. We are seeing that with VIT, we're seeing a more occurrence in Canada than initially believed. So now we're at about 1 in 50,000 to 1 in 100,000 in parts of Canada. However, even 1 in 25,000, 1 in 50,000, 1 in 250,000 risk is still a pretty low risk compared to the advantage of the vaccine. So this issue of, is the vaccine of benefit to me versus taking a chance with the disease has been ongoing. And what we do know is that right now, if you were to look at certain provinces like Alberta, you have a 4% chance of hospitalization if you have COVID, which is actually quite a significant high number. Even though we've identified certain risk factors for people who are going to have more severe COVID, we're also seeing a lot of cases of much younger people in ICUs and having severe disease. The second issue, which is quite significant, is that we're now uncovering more and more that even people who've had very mild disease can have a long COVID or post-COVID syndrome. And then at the end of it all, of course, there's this issue of contributing to community protection. More and more data are coming in around vaccines and variants that we've been able to say, okay, well, actually, a lot of these vaccines, AstraZeneca included, are seem to be performing really well against the B117 variant, which is the main variant in Canada right now. And then we're also seeing better than expected protection against the B1351 and some indications out of India that the mRNA vaccines that they looked at are also protective against the variant first described in India. And what's really important with these also is that whereas some of them have decreased protection against all infection with the variants, the protection against severe disease and death from variants with these vaccines is really high. From the vaccine alone, you cannot test positive for COVID. You're not getting the whole virus injected. All the COVID-19 vaccines that we have are non-live vaccines, whereby you're only getting a recipe on how to make the spike protein, which is one of the proteins of the coronavirus. We have seen, however, people who had the vaccine and then got COVID at around the same time, because sometimes people feel that after they've had the first shot, even within a few days, they tend to do less cautious things than they were doing before, and people can get infected at the same time. We've actually have two important studies to draw upon when we look at children's vaccines. Pfizer has done over 2,200 children in their 12 to 15 year old study. Moderna has over 3,000 children, 12 to 15, in their study looking at the vaccine efficacy and also safety. We've seen in those studies that that children have robust immune systems. It seems to be incredibly protective against disease. And there are no new safety signals that have come out of those studies. So far, the only safety concerns are the same ones in adults, such as a sore arm, and minor effects that can be dealt with at home. And again, it gives kids the chance to be protected, hopefully contributing to community protection, having a more normal school year in the upcoming year, and also hopefully preventing long-term effects of COVID, which we have seen in children.